Okay, let's unpack this. Globally, it really hits you, doesn't it? These acute respiratory infections.
Things like pneumonia, bronchiolitis.
Exactly. They're a leading cause of death for kids under 5. We're talking, 15 to 20% of all deaths in that age group.
It's a staggering figure, really underscores how vital prevention is in those early years.
It really does. And if you have little ones or know people who do, that statistic just stops you in your tracks.
Absolutely.
So that's where we're headed today in this deep dive. We've got this really interesting research proposal. It's from Durgapur in West Bengal. And they're digging into how we can better protect young children, focusing right on the mothers.
Yeah, and the material we looked at is pretty comprehensive. There's the research synopsis itself, background, goals, methods, what they hope to find. But we also dove into their literature review.
Which pulls together a lot, right? Global studies, local ones.
Exactly. WHO, UNICEF data, medical texts, research databases. It's quite a broad base of information.
So, a real wealth of stuff. Our mission today, then, is to sift through it all, pinpoint the crucial bits, and really get a clear picture of how, structured support for mothers can make a real difference for kids' health without the jargon.
That's the plan. Think of this as your shortcut to understanding a major health issue and a really promising way to tackle it.
Good. So if you're interested in public health, child development, or just effective community action,
there's definitely something here for you.
Okay, let's start with the problem itself, the sheer scale of it. This burden of ARIs, acute respiratory infections, on young children.
It's a huge global health issue, no doubt, especially in developing countries, India, for instance.
And those initial numbers we mentioned really drive that home.
They do. And the research points to several interconnected reasons why the burden is so high.
Okay, so what are the main drivers here? What makes it such a persistent problem?
Well, consistently, you see things like poor hygiene. That makes it easy for germs to spread.
Right. Obvious, but critical.
Then there's the challenge of caregiver knowledge. Often mothers, naturally, maybe not fully knowing how infections spread or the best ways to prevent them.
Okay.
Overcrowding in homes is another big one. Germs spread fast in close quarters.
Makes sense.
And then, sadly, limited access to good health care. So infections might not get treated early or well.
And this proposal specifically looks at Durgapur, West Bengal. Why Durgapur?
Well, the researchers point out that while we have national data for India, there's a real gap for semi-urban areas like Durgapur.
So it's about getting that localized picture.
Exactly. This study aims to fill that gap, provide insights relevant right there in that community.
Which you need, right, to tailor solutions effectively.
Definitely.
Now, the research title itself puts mothers front and center. Why the specific focus on them?
It's pretty clear why. Across most cultures, mothers are the main caregivers, especially for very young children.
The first ones to notice if something's wrong?
Usually, yes. They handle most of the day-to-day care, hygiene routines. They're the first line of defense, really. Okay. And the research is smart about this. It acknowledges that what a mother knows and does isn't, in a vacuum.
Right. It's influenced by other things.
Exactly. Socioeconomic status, cultural beliefs, education level. All these things play a part.
Which means you can't just have a one-size-fits-all approach.
Precisely. Interventions need to be tailored, sensitive to all those factors.
So that brings us to what the existing research says, that literature review you mentioned. What are the key findings from all those studies?
Well, first, the global impact. That 15-20% mortality figure for under 5s keeps coming up. It's a consistent, major theme.
Undeniable.
But beyond the scale, there's strong evidence that maternal education level makes a real difference. More education often correlates with lower ARI rates.
That feels intuitive, doesn't it? But the review also mentioned that past efforts, just focusing on giving mothers information, haven't always worked that well.
That's a really important point. Just providing facts often isn't enough to change behavior long term.
Why not?
The literature suggests inconsistency was a big issue, how the programs were actually done. Sporadic efforts, maybe not well structured, no follow-up.
So they didn't stick.
Likely not. Which really highlights why a structured, sustained approach, like the one proposed here, is potentially much more effective.
Okay, so what kinds of approaches have shown more promise then?
The review points to a few things. Structured teaching programs, where information is given systematically. Hands-on demonstration sessions are also key, seeing and practicing skills.
Like hand washing, maybe?
Exactly. And peer support groups, mothers learning from each other, building that community support. That seems powerful.
Those sound practical. Building confidence, not just knowledge.
That's the idea.
Now, going back to the need for local data, like in Durgapur, what other themes from the wider research reinforce why this study is needed?
Well, indoor air pollution comes up a lot as a major risk factor in the home.
From cooking fires and things.
Yes, especially with traditional stoves or open fires. Very relevant in many areas. The literature also really stresses prevention over just treatment. Empowering mothers to prevent ARIs before they start, that's seen as more impactful.
Makes sense. Stop it before it begins.
Exactly. And seasonality is mentioned. ARI patterns can shift with seasons, so timing interventions could be smart.
Target the high-risk periods?
Potentially, yes. Nutrition is also highlighted. A child's nutritional status affects their susceptibility. It's all connected.
Right.
And while it's about prevention, the review reminds us viruses are a major cause. So practices that stop virus spread are crucial.
Hand washing again, ventilation.
And finally, especially for low-income settings, the need for affordable mother-led solutions is a constant theme. Sustainable ideas.
So it's complex, lots of interconnected pieces. Let's zero in on maternal knowledge and practices. What's the current picture, according to the research?
Well, studies show low awareness about ARIs can, unfortunately, lead to more severe outcomes.
Because they don't spot the danger signs early.
Or don't realize how important quick action is, yes. This can let infections get worse. There are also clear gaps identified in both knowledge and actual practice, especially in rural areas. Traditional beliefs might sometimes clash with effective prevention, or there's just a lack of awareness about simple, proven measures.
And why is spotting those early signs so critical?
It's key for getting the right care quickly, before things escalate. Mothers are usually the first to notice subtle changes: breathing, feeding, activity, recognizing things like fast breathing, a bad cough, fever, that prompts them to seek help.
Right.
And the literature really emphasizes making educational content culturally sensitive. It has to resonate locally to be adopted.
You can't just drop in generic advice. It has to fit the context.
Absolutely. And training can definitely improve symptom recognition, but literacy levels vary.
So you need more than just written leaflets.
Definitely. Visuals, demonstrations, talking things through. Health literacy and general understanding and using health info is also crucial for decision-making.
And it's not just the mother alone, is it?
Yeah.
Family, community influence things too.
That's a very important point. Family and peers shape behaviors. So involving the wider community, maybe using peer support, could be really beneficial.
Makes sense.
Research also shows that factors like the mother's own education and getting advice during pregnancy, antenatal counseling, are strong predictors of her health knowledge.
Interesting.
And finally, there's value in a holistic approach. Maybe integrating advice on the mother's nutrition with infection prevention, since her health impacts the child's.
Okay, so mothers are central, but embedded in this wider context. Let's focus now on the home. What can actually be done in the home to prevent ARIs?
The research is very clear here. Good hygiene is fundamental. Simple things, but powerful.
Like?
Regular, proper hand washing, soak and water, and good ventilation, fresh air circulating. Both cut down transmission significantly.
Got it.
Breastfeeding is another big one, especially exclusive breastfeeding for the first 6 months. It provides amazing protection.
Those antibodies, right?
Exactly. Boosts the baby's immune system.
Standard advice, but always worth repeating how critical it is. What else for home prevention?
Safe cooking practices. Minimizing indoor smoke exposure is huge.
Cleaner stoves, ventilation.
Yes. It makes a big difference for respiratory health, especially for little lungs. Overcrowding is also linked to poorer child health, so education on hygiene within the home, maybe spacing if possible, and importantly, addressing harmful traditional beliefs or remedies that might delay proper medical care.
Tackling misinformation. That's vital.
Absolutely. Developing clear guides for safe home management of mild symptoms can also help. Empowering mothers, but also making it clear when to seek professional help.
Right, knowing the limits.
And maternal self-efficacy.
Yeah.
Her belief she can do these things. Skill-based training helps build that confidence.
Okay.
Also, getting baseline data on what people are already doing at home helps tailor the intervention.
Makes sense. Start where people are.
And remembering other caregivers matter too involve the whole household. Plus, maybe adding advice tailored to specific seasons when risk might be higher.
So a real package of measures for the household. Now let's get to the core of this specific proposal. The structured maternal engagement. What does that actually involve?
It's designed as a multi-part approach, much more than just handing out flyers.
Okay.
It includes interactive educational sessions, workshops, maybe storytelling, role-playing, making it engaging. A really key part is home-based demonstrations. Health workers actually visiting homes, showing proper hand washing, feeding techniques, hygiene practices in that specific home environment.
Very practical and personalized.
Exactly. Plus, regular follow-up. Phone calls, more home visits to reinforce learning, troubleshoot problems, offer encouragement.
So it's sustained support.
Yes. And actively involving mothers in childcare routines, specifically training on recognizing ARI symptoms and knowing when to get medical help.
Okay.
And finally, providing informational tools charts, simple brochures, maybe videos as ongoing reminders and resources for them at home.
So what's the main goal? What are they hoping this structured engagement will achieve?
Well, the direct objectives are to significantly improve mothers' knowledge about ARIs and get them consistently using effective prevention practices at home.
Makes sense.
And the ultimate aim of the study itself is to see a measurable drop in ARI cases or their severity among the children whose mothers participated.
Right.
But there's also a bigger hope that this study could provide a kind of model, a practical blueprint for engaging mothers on other child health issues too.
That would be incredibly valuable. A framework you could adapt elsewhere.
Exactly.
And what about the broader public health significance of this kind of research?
Well, if it shows strong positive results, it could really influence policy, provide solid evidence for embedding this kind of maternal education into standard pediatric care or community health programs.
Shifting more towards prevention at the community level?
Precisely, which could, significantly reduce the overall ARI burden and associated costs. The long view is empowering mothers with sustainable health practices for healthier kids and communities.
So, the real takeaway seems to be structured, supportive education for mothers could be a truly powerful lever against a major threat to young children.
That's the core message, yes. And it leaves you with a question to think about, doesn't it?
Which is?
Given this evidence, how can our communities, our healthcare systems, better support mothers, especially in places with limited resources, to actually adopt these life-saving practices?
That's a really important question to chew on. And if you want to explore this more, the source materials point towards great resources.
WHO, CDC, UNICEF India, the Indian Academy of Pediatrics.
Their websites have a ton of information, global and local perspectives on childhood respiratory infections and maternal health. Worth checking out.
Definitely, because ultimately, by focusing on empowering mothers and building these community-based solutions, there's a real chance to make a big difference in child health outcomes.
A healthier start for many more children.